I travel around the state this summer on these Thursday mornings, checking in with folks in a wide variety of Vermont's small cities and towns, I like to check in with people who oftentimes are the leaders of various local institutions and organizations, and of course in Randolph. One of the leading institutions in town is the local hospital, which is Gifford Medical Center. And Dan Bennett, that hospital's CEO, has been kind enough to decide he could come by and join me for a little bit of time on the radio this morning. And good morning, Mr. Bennett. Thanks so much for being here.
Good morning, Dave. Thanks for having me.
And I wanted to check in with you and just sort of find out, what's life like for for the CEO of a hospital in a small rural area. I mean, obviously, lots of waves hitting the shores in healthcare these days, and so I sort of want to get the flavor of how that affects a place like Gifford Medical Center, and find out from you first off, how many beds are there at the hospital? How big a place is it?
So the hospital is a 25-bed critical access hospital.
Mm-hmm.
So that's the critical access is a federal designation that's provided to rural hospitals that meet particular criteria. But the program ultimately is designed to support healthcare delivered in the rural environments and to help those organizations succeed so they can continue meeting the needs in their communities.
And I remember back in the day when I was a young parent and soon-to-be parent and that sort of stuff, Gifford had an excellent reputation as a place to have your baby get born. Is that still the case?
That is still the case, and I believe Gifford was the first hospital in the state that had a nurse midwifery program, and I believe that started in 1977, and that still goes strong. We have an amazing program. We did our Employee Recognition Award ceremony 2 weeks ago, where we recognize employees who've been here for multiples of 5 years,
Mm-hmm.
and we recognized three of our long-term nurses in our birthing center, one who had been here for, I believe she was 35, and two of them were over 20. So we've had a good span of people being dedicated to being there, great providers, certified nurse midwives, OBGYNs, and great nurses there. And my son was born there a little over 22 years ago. So,
Oh wow! Huh.
yeah.
Huh. And it's it's a sign of a good employer too, who keeps workers around for 35 years. That's you got to be proud of that. I mean,
Well, that is the goal. Yes.
yeah, that's a good thing. And in terms of your role in the community, I would think that that folks here in Randolph. So I think there's a certain amount of pride in the community from what I've gathered over the years. In terms of just having a place like Gifford Medical Center here.
Yeah, as I was telling you earlier, I've been back here in Randolph for 2 years, and one of the reasons I wanted to come back is that this is a kind of an organization that is within the community, but it's also of the community, and the people who work here. They are the friends, neighbors, relatives of the people that they serve, and there's a certain accountability that comes from that. And
Yep.
for me, that is one of the fulfilling parts of being a part of this organization, and of course in leading this organization. And we do have a long history here, and just a tremendous amount of support.
It's just amazing that organic relationship that gets created between an organization like, a small rural hospital, even a slightly larger hospital. My wife works for CVMC up in Berlin, and people joke with us about how she seems to know everybody in central Vermont. Because she's been around a while, and of course my work as a reporter. Somebody was laughing the other day and saying, Kathy knows half the people in Central Vermont, and Dave knows the other half, or something. So it is. I mean, that's one of the things we love about Vermont in general. Of course, is just how much there is that sense of walking down Main Street in your community on a Saturday morning, and so many of the people come up to you and say hello, and they know you. And tell me about your own history, though, because you told me that you started, I guess, at Gifford just out of college, and then went away for a while. Where'd you go? And tell me about all that.
I did. I'm a Vermont native. I grew up over in Brandon, and my first job out of college was working in the accounting department at Gifford, and I worked there for a couple of years. and met my wife there. And as I noted, we had our son at Gifford, and he turned out okay, so that's good.
Yeah, yeah.
And but worked a couple other places in Vermont, but I was over in Maine for 17 years, and then came back just about 2 years ago to come back to Gifford, and was wanted to come back to Vermont, wanted to be back with family and friends, but also wanted to be back at an organization like Gifford, and been very happy to be back in the community, and my wife and I are enjoying it very much.
That's great. So tell me about Gifford's role vis-a-vis, I mean, it seems like, a half an hour south of here, you have this huge healthcare behemoth, which is, of course, the Dartmouth-Hitchcock Medical Center. And then an hour north of here, you have the University of Vermont Medical Center in Burlington, tertiary care hospitals, the two sort of giants in the region here. You're not affiliated, or are you affiliated with either of them? No. Okay.
No, we're not. We're an independent organization, and Gifford actually made a change in 2014 and took on the designation as a federally qualified health center in addition. So that is a federal program that for primary care-led organizations. And I think when you think of Gifford in the context of a UVM medical center, a UVM health network, or a Dartmouth-Hitchcock, that really is a difference between us. We are a primary care-led organization.
Okay.
Our goal is to provide those primary care services, to focus on preventive health care, to do the things that are necessary to try to help people stay healthy. Now, those other organizations have those goals as well, but we are uniquely situated, if you will, in terms of our role within the community to do that very well. So we have a different type of service that we offer. Our providers, our nurses, our physicians, our nurse practitioners, they're able to spend time with their patients. They get to know their patients. They have the opportunity to interact with them in a way that might help us provide services and provide resources to people that you might not see occur in the same way in a tertiary care center or whatnot.
Right.
So it's a different kind of service, an individualized type of care that we provide, and we think that that is the right model for this type of community for our area, and we do think it differentiates us from some of those larger organizations.
I'm just sort of thinking in terms of another federally qualified health center in the WDEV listening area. There is a place, I think it's called the Health Center in Plainfield. And they so is it sort of, it must be sort of along that model then, really.
It is the same model. Dr. Matthew up in Plainfield, he runs the health center, a very good organization up there. So the main goal there is that to have an integrated primary care experience, if you will. So like Dr. Matthew up at the health center at Gifford, we have primary care providers. We also have integrated mental health services, addiction medicine services, and we provide access to dental care as well. And those are all possible within the FQHC model.
Right. That's interesting. Speaking of Dr. Matthew, he told me a few years ago, and I think I might have mentioned this in the email I sent to you or Mary Ellen Applequist of your staff. We were in touch yesterday, and Dr. Matthew mentioned to me that one of the things he found over the years and has really worked to address in that Plainfield, Marshfield area is pretty widespread vitamin D deficiency among patients there. And it just occurred to me that in certain parts of Vermont or in certain parts of the country, there are going to be certain commonalities, traits that show up in large numbers or large percentages of the patients coming into your healthcare professionals. Do you notice anything like that around here? I mean, maybe vitamin D deficiency is a big one here too, but
well, the vitamin D is something. I think it's a northern climate thing because it's impacted by the amount of sunlight you get. And although there are many great things about living in these northern climates, we don't get quite as much sun as some of our southern counterparts.
Here I am in September, and I'm pretty pale, actually.
Yeah, I played golf last weekend, so I got some sun.
You got a little. I see a little tan.
But no, that is something that we see there. But one of the things that you see at our demographic demographic, whether it's Vermont or particularly in rural areas of Vermont, is we tend to have a little bit of an older population, and so we're working with people often who have more chronic diseases or more issues going on as they age. So again, for us, and like Dr. Matthew, having an FQHC, having a primary care focused organization really is the right model for this type of community. And so we are often dealing with people with multiple chronic illnesses, and we have a lot of wraparound services to help with that.
Wow. And now I wanted to ask another question about the FQHC model, this federally qualified health center, and your role also as you know. We think of Gifford as a medical center or as a hospital. You're also able to do surgeries and that kind of stuff here as well, right?
We are, and that's one of the areas that we've been redeveloping over the last couple of years. One of the difficulties there's a lot of joys in overseeing an organization like this, but there's also a lot of challenges. And in an organization our size, a hospital our size, you lose one surgeon, that could be half of your surgery staff.
Yeah.
So we've had some of those challenges the last couple of years, but we're very happy right now. We just got two great new surgeons, Dr. Edwards and Dr. Montesino, who've joined us. We've got two new orthopedic surgeons, and Dr. Oram and Dr. Chase, who are with us. So we do offer those services. We can offer the same high quality care you can get elsewhere, and but that's obviously very important to the local community. There are those core type services you want to be able to provide here, and we can do that at Gifford.
So it's an interesting range. I mean, we talked about the tertiary care centers, which are they obviously have the full range of surgical services and that sort of thing. They are not as much known and perhaps don't focus quite as much on the primary care and the addiction treatment and the mental health and dentistry and so on as your organization or as the health center in Plainfield. But you're sort of it sounds like straddling both worlds in a way.
We are, and you asked the question earlier about whether we're affiliated, independent. We are an independent organization, but you can't provide healthcare services in an organization in an area like this without having good partnerships. And we do work closely with Dartmouth-Hitchcock. We have cardiologists from Dartmouth-Hitchcock who are on site at Gifford on a regular basis, twice a week, I believe. One of our ortho surgeons, Dr. Oram, he is a specialist who does hip and knee replacement surgeries. He is a Dartmouth-Hitchcock physician who works with us 2 days a week. So, it is a situation where we are independent, we are tied to this community, but we do work with other partners to provide services. And obviously we work with our local home health agencies, with the Clara Martin Center here locally as well, our designated agency. So
Sure.
we have a lot of those relationships, and we also work with Central Vermont and UVM with some other services.
It makes a lot of sense because it helps you provide a fuller range of services to folks if you're able to draw on those resources, I'm sure.
It does, and it allows people to get their services close to home at a place they know and trust, but also to take advantage of some of the resources that exist, just outside of our area.
Sure. All right. Well, Dan Bennett of the Gifford Medical Center, the CEO of that hospital here in Randolph, I really appreciate you stopping by this morning and sharing some information about your institution, and I wish you luck going into the future.